We will begin momentarily.
West, representing the fourth. Good evening to our global audience and welcome to a milestone broadcast. I am Mira West, representing the Foresight Institute of Research and Translation. Tonight, we are live on Brave Talk and YouTube for the November edition of the Dental-Medicine Chronicles. This event is proudly organized by FIRAT Rwanda in collaboration with the Rwanda Dento-Medical Society. Our theme for this episode is as intriguing as it is vital: unmasking the smiles, myths, misconceptions, and the truths that shape oral health. We are here to explore how oral hygiene shapes overall health and what we can do together to build a brighter future for Africa. To guide us through this journey, we have an exceptional host and two distinguished speakers. Leading tonight's program is the DMC Program Officer, Ms. Umuhoza N. Elisabeth. Ms. Elisabeth is a true public oral health enthusiast. Currently a dental therapy student at the University of Rwanda College of Medicine and Health Sciences, she combines academic rigor with a passion for innovation, possessing skills in laser engraving and 3D printing. Her leadership is felt across the continent. She serves as the Projects and Outreach Coordinator for the Dento-Medical Society Rwanda and the Secretary General for In-Depth Dentistry Africa. Joining Ms. Elisabeth to debunk myths and share truths are two heavyweights in the field of dentistry. First, we are honored to welcome Associate Professor Julian Murerehe. She is a lecturer and associate professor of community dentistry at the University of Rwanda College of Medicine and Health Sciences. Holding a PhD in community dentistry from Wits University, her expertise centers on the critical relationship between oral health and systemic health. Her excellence in research has been recognized globally, including the receipt of the 2023 International Association for Dental and Craniofacial Research (IADR) Cardiology Research Award. Sharing the virtual stage with her is Dr. Benedict Amalime. Dr. Amalime is an oral and maxillofacial surgeon who serves as a senior consultant at the University Teaching Hospital Kigali and a senior lecturer at the School of Dentistry, UR. He is a fellow of the West African College of Surgeons with a specific interest in facial traumatology and temporomandibular disorders. A true Pan-African educator, he has trained students in Kenya, Uganda, Nigeria, and Rwanda, and is part of the pioneering faculty for the Masters in Dental Surgery in Kigali. We are set for an enlightening session that promises to change the way we view our smiles. Thank you for joining the movement. And now, I am delighted to hand over the microphone to your host for the evening, Miss Elisabeth Umuhoza. Miss Elisabeth, the floor is yours.
Thank you so much, Myra West, for giving me the phone. Tonight, I'm welcoming all the global attendees of this chapter of Dental-Medicine Chronicles of November edition. Thank you all and feel welcomed. Feel free to ask any question of your interest. So today we'll be discussing on this topic, myths and conceptions about dental dental health. And today's session will be flowing like this. I'll be asking a question to one of our guests, and he or she uh, will be answering like that.
I'm no longer getting Elizabeth. I don't know whether it's me or the
You're
internet
not
is on
hearing me?
her.
Okay,
I
I can
can't
come
hear her.
again. Can you hear me now?
Now I can hear you.
All right. So I was saying we are going to begin with some few questions, like many people believe in some myths, and I chose many believed myths, and I'm going to start with the first one, which goes like, brushing harder makes the teeth more clean. Is it true? Is implying a lot of force cleaning the teeth better, or something else?
Okay, good evening, everyone, and thank you, Elizabeth, for the introduction and indeed for having me today. I take this opportunity also to congratulate the team of the association for this initiative. It's really needed and it's a good initiative, to raise awareness of oral health in our community and beyond. So I take this opportunity to encourage you and encourage you to keep it up. So coming back to your question about the cleaning teeth harder, whether it is, help to clean teeth well or not. So maybe let's start by reminding ourselves the intent of brushing. Why do we have to brush teeth? So the target when we brush teeth, the intent is to remove the dental plaque, food debris, and those are the soft matters which are easily removed by applying the soft gentle forces, and even the consistent stroke motions. So dental debris and dental plaque while brushing, they don't need really to apply too much forces to scrub tooth surfaces to be able to remove them. Here I want to emphasize that once dental plaque or food debris has hardened and become, calculus, in that context we know them as calculus, whatever force you apply or whatever motion you put maybe to remove those hard, debris, they are not going to be removed. So we have maybe to let the community know that once the dental plaque and soft matters have hardened, so they can't be removed by simple brushing technique. In that context, we have to advise, the affected individuals to look for medical patients or visit dental, practitioners to help them to remove dental calculus, those hardened, darkness which cannot be removed by simple brushing technique. Because most of the time, people use too much force when they see that their teeth, they don't look normal. They are really obvious darkness or, plaques or calculus on the teeth, and they try to put too much force to be able to remove them. So the objective is to let know them that we brush to remove what can be removed, which are soft matters, dental plaques, and food debris. And when we use the appropriate brushing technique, those can easily be removed without applying too much forces. So it's up to us to, to let the community know that we brush to remove those soft matters. So in many societies, people think that brushing teeth is like, cleaning the dirty surface, where you have to use hard equipment, maybe use too much force to clean the surface. And they think that that applies also for cleaning teeth. That is why they use too much forces, using even, toothbrush with hard bristle to brush to clean teeth. They scrub tooth surfaces to be able to remove dirtiness. But that is not the appropriate technique, and that technique is harmful for the gum and for even the teeth. So maybe we can talk a little bit about the consequences associated with the hard brushing. So we can talk about tooth recession. When there is too much forces or hard cleaning of teeth, there is what we call gum recession. Gum recession is when the gum is taken away from the tooth surfaces, the root. You remember that the root is covered by the gum. So when there is those so much forces, with time, the gum will go away from the root, and then the roots become exposed. So in that context, the affected individuals start to feel the sensitivity. Tooth sensitivity. Tooth sensitivity is that discomfort or even pain affected individuals feel during eating, be it the cold or hot meals. And, that can even affect the eating habit, or they can even, prevent them to eat comfortably. So another thing you can talk about when you use the hard cleaning of teeth, it's easy development of root cavities. So people who brush teeth using too much forces, with time there is recession, and once there are recessions, the roots are exposed to development of dental cavities, which are really a very big problem, because even the treatment of root cavities is require complex treatment, is sometimes difficult, and you understand that in that context that can lead even to the loss of teeth, exposing people to the more complicated issues because of that technique. We can also talk about the enamel wear. So when you apply too much forces while brushing, that can lead to the destruction of the enamel or cementum, which is worn away, also exposing the dentin, which worsen even the sensitivity problem, and even can lead to the exposition of the dentin with the discoloration of the tooth, because the dentin is yellowish and now it's exposed. You understand that the color of the tooth can change. So here you understand that that can even affect the aesthetic, the appearance, how the affected individual appear. So you understand that once the gum is no longer to the level where it's supposed to be, when you smile, that's not comfortable. So you can understand that it can affect the appearance, the aesthetic, even starting to decrease the self-confidence, and even prevent people to smile or to talk or to communicate. So this is short what I can talk about the consequences associated with hard tooth brushing. So regarding the appropriate technique for brushing, the first thing I can talk about is about think about the tool to brush. What do we use to brush? What do we have to use to brush tooth, in a normal way? So the first advice is to make sure that you use a toothbrush which is really appropriate. So the advice is to use a soft bristle toothbrush. So it's prohibited to use a hard bristle toothbrush because it contributes a lot to the destruction of the tooth surfaces and even the gum. Also, it's advisable to apply gentle force, aiming to remove soft matters, not hard matters, because no matter how much forces you use, no matter how you scrub your tooth surfaces, when those debris has hardened and become calcareous, they can't be removed by brushing technique. Instead, in that case, you will destroy teeth and gum. So it's advisable to use, to apply, gentle force, and also use the smaller or circular movements. So you have seen that most of our population use the horizontal motions, and that is not really good for teeth, because they most of the time contribute to the gum recession and also to the enamel wear. So it's advisable to use those small circle motions and make sure that you brush at least 2 to 3 minutes, not too long, but not taking it too long to brush teeth. So those are some of the advisable technique to use, but also remember to complement, the brushing technique with flossing, aiming to brush after each meal, because you have seen that people, they wake up, they brush teeth, they eat, and then they go to work, and you understand that the tooth debris, the food debris remain in the mouth the whole day. So it's good to tell the community that we brush because we aim to remove those food debris which are harmful when they are decomposed in the oral cavity. So those are some of the consequences and even the appropriate technique I can talk about. Thank you.
Thank you so much. Thank you so much for the well explanation of this. There are some things I didn't know. So thank you very much. I think this is making a lot of impact. So
Okay,
I have another
I'm not
question.
getting Elisabeth well. I'm not sure whether you can get me when I'm speaking. Please let me know whether you are getting me or whether the internet is bad from my side.
We are getting you. We are
Elisabeth,
getting you. I'm getting
okay,
you.
because I'm hardly getting you.
Still now,
Okay, come. Yes, now I can get you.
you can hear me now.
Now I can hear
What
you
about
well.
others? Okay, thank you. I can see they're hearing me by now. So there is some people say that cavities happen only because of sugar. Is it really true, or some other facts like bad habits of brushing or even other factors matter also? Is it really only sugar that causes cavities? I wish to hear from you again.
Okay, good question. So maybe let me start by highlighting that tooth cavities is the most widely spread chronic diseases worldwide and constitute a major global public health challenges. And also, only sugar alone is not the only factors for development of dental cavities. In fact, dental caries is a multifactorial disease. This means that, dental cavities develops because of interaction of too many factors, which interact together to help develop dental caries. Those factors, if I can summarize them in groups, I can talk about oral cavity environment related factors. I can talk about maybe some individual level, factors, some family related factors, and even some community related factors. So if I try maybe to talk about some of the oral cavity related environment factors, we can talk about the tooth itself, the host. So how is the tooth is? Is it the tooth well mineralized? The structure of the tooth, all those, indicate whether the tooth can easily develop cavities or not. So if the cavity is weak, not fully mineralized, or have some defects, you understand that tooth is prone to the development of dental cavities compared to the tooth which is hard, well mineralized, where there are smooth surfaces. So in fact, you can give an example of the teeth, the permanent teeth, which are hard and fully mineralized compared to the primary teeth. So you understand that, primary teeth are at high risk of developing dental caries because they are soft compared to the permanent teeth. So the host, the tooth itself, how it is, that can be a factor, which can be classified as oral cavity environment factors for development of dental cavities. So also regarding the oral related, factors, we can talk about dental plaque, as we were saying, the composition of dental plaque, the bacteria in the oral cavity, the saliva, the consistency of the saliva, the composition of the saliva, the bacteria which are composed of the dental plaque. All those can be risk factors to the dental caries development. So those are some of the factors related to the oral cavity environment. So looking at the individual factors, we can think about the individual behavior. So the behavior you have or I have can be a risk factors for the development of dental caries. Let's give an example of, for example, an individual who is used to take snack between meals, always taking sweets, snack, you understand that that behavior can be a risk factors for developing dental caries compared to a person who is, conscious of, the harmful effect of snacks for teeth. Also, we can talk about, the personal, let's say, systemic diseases. So if an individual have a systematic disease, let's say like HIV, diabetes, or other systematic diseases, which put him or her at risk of developing dental caries, you understand that can be considered as individual factors leading to the development, easy development of dental caries. Can be a factors which easily help development of dental caries for an individual. So an educated individual compared to someone who can't go online and read maybe about good or technique for brushing, you understand that the raw literacy can be an individual factors leading to the to the development of dental caries. Those are some of the individual factors we can maybe discuss about the individual, but there are much more you can also think about. So we can also look at the family levels factors. So at family level, we can talk about, let's maybe give an example of socio-economic factors. Maybe if a family is in a state of not being able to buy at least the toothbrush or toothpaste, you understand that that become a risk factors for families to develop dental caries. If maybe it's difficult for them maybe to pay for dental cleaning or even dental checkup, you understand that the socioeconomic factors can be a family level risk factors that contribute to caries development. We can also think about maybe the family behavior. Also, behavior can become as family level factors, where maybe in the family there is a habit of sipping without brushing. Maybe they use also to take snacks every time between meals. Maybe children, they are not, instructed or supported on brushing technique. All those can be the family level risk factors leading to the, to development of dental caries. So let's maybe look at a little bit to the community level factors we can think about. Let's say if you live in a community where it's difficult to access oral health system, or you cannot maybe meet a dentist easily, you understand that it will be difficult for you to get instruction maybe on how to keep good oral hygiene or to care for your teeth. Or even when you have a problem like you need to clean teeth, that will be difficult for the individuals to access, the healthcare systems. That can be considered as one of the individual or the community level factors. We can also think about the culture, in a community where the culture belief is, harmful to the teeth. Like the example we're giving for the first question, if people think that brushing harder is good, or maybe cleaning teeth is not good, all those culture beliefs can affect individuals and, put them at risk of developing dental caries. So those are short what I can discuss about many factors associated with development of dental care, not only sugar, but all other factors. Maybe to conclude, the good thing is that all those factors are modifiable. And also, if we have maybe to promote oral health and maybe help our community, having a good oral hygiene, we have to look at all those factors, looking at all angles. So if you wanna maybe think of intervention targeting only sugar, forgetting maybe the systemic diseases, forgetting maybe the interdisciplinary collaboration, forgetting maybe about, the individual factors or community factors. So that will not work. You will, yes, bring those interventions, but they are not going to work. That is why we have to think critically when it comes to tackle or to to recommend interventions to tackle dental caries in the community, depending on the context, because intervention maybe in Rwanda can be different from an intervention you can suggest maybe in USA, depending on the context, the culture, So those things are important, not only sugar. Thank you.
Thank you so much. Thank you so much. This was very wonderful. I didn't know that cavities can be linked to bad habits of brushing or some genetic factors. So thank you very much for this. And so I have another one question. Can everyone hear me, please?
Yes, I'm hearing you, and I think others also can hear you as I'm hearing you.
All right, thank you. So some people say that if your gums bleed, stop brushing. If they bleed, stop brushing. What does a bleeding gum mean to someone's oral health, and how should one care for his oral health while his or her gum starts bleeding?
Good. So gum bleeding is a condition where you can see that your gum bleeds either spontaneously, maybe when you start to brush, you see that there are blood in the coming from the gum. When you try to floss, you see that there is blood coming, from your gum. So that is the condition known as gum bleeding. So when the gum bleeds, most of the time, this is indicated there is an inflammation of the gum tissue, or what we know by gingivitis. So gingivitis later can even develop to give what we call periodontitis. So what to understand first is to know what are the factors associated with gum bleeding. Why can a gum bleed, or why do we see, bleeding in gum? So there are many factors also, as we have seen for the cavity development. So when it comes to gum bleeding, you can think about local factors, we can think about behavior factors, we can also see some systematic factors which contribute to gum bleeding. So to be able to prevent that condition, it's important to understand all those factors so that you can help the patient, or educate the patient really to prevent the gum bleeding. So maybe to give an example of some of those factors, the most important factor is the poor oral hygiene, practice. As you have seen, poor oral hygiene practice lead to the plaque buildup, which hardens with time and even lead to the calculuses. So calculus are porous, and even they contribute a lot to the inflammation of the gum. So poor practices is really a key, factors which contribute to the gum bleeding in most of the case, but also there are other factors we can't ignore. So among them, we can talk about the systematic diseases, like, having some of systematic diseases, such as diabetes, let's say maybe cardiovascular diseases, some blood clotting disorders. All those are some systematic diseases which can contribute to gum bleeding, And we have really to understand that when we have a patient, yes, we have to look at the obvious factors, the plaque, the local factors, but also we have to think about those systematic diseases, because most of the time you can have a patient in the clinic and you see that the patient really try his or her best to clean teeth, the mouth is clean, but still he or she complain about gum bleeding. So in that case, you have to think about all other factors which can contribute to gum bleeding. So apart from systematic diseases, there are also other, nutritional deficiencies. When maybe you try to read about, the association between, eating well and, oral health, oral disease development, you will see that there is interaction between vitamin deficiency and development of gum bleeding. So the deficiency of some vitamins such as vitamin C, vitamin K, and others can also lead to the development of gum bleeding. So we can't forget some hormonal changes like during pregnancy, most of the time, pregnant women complain about gum bleeding, even if they brush, or even when they don't brush, it's aggravated. That condition is aggravated during the pregnancy period because of hormonal change. The period of puberty and other period or other condition which, are associated with can also be factors for, seeing the gum bleeding. So I can't forget medication, some medication. So there is of some medications such as seizures, some calcium channel blockers such as nifedipine and the others can also contribute to the gum bleeding. All those are factors we have to think about. That is why you see, even in a dentist, when you have a patient and you have to take a history, concentrating on the oral cavity, you have to look at the patient as a whole because there are more other factors contributing to the oral condition you see in the mouth. So we can't forget about other local factors such as maybe dental appliances which are not fitting well. If the denture is not fitting well, that can contribute to gum bleeding, stress, other local factors or a feeling which is not really good can also lead to the inflammation of the gum and lead to the bleeding of the gum. So to understand that all those factors, we have to look at them, to be able to help the patient. So now, what to do may be to care for good oral hygiene. So the most important thing is to advise to ensure good oral hygiene practice because poor brushing worsens even all those other conditions we have seen. Yes, you may have hormonal change, you might have systemic diseases, but if in addition to that, you add to have that bad oral hygiene and the plaques are accumulated in the mouth, to understand that the condition is worsened. That is why it is important to really to advise the patient to take good oral hygiene and to show them how to do it. So as you have seen, it's necessary to brush at least 2 to 3 times a day, using the appropriate brushing, technique, appropriate toothbrush, floss at least once daily. It's also advisable to use antibacterial mouth or lenses when it's possible. So all those are, advice we can give to the patients to be able to help them to keep good oral hygiene and health gum. But also, we can't forget about those other factors which are not related to oral hygiene. So in case maybe the patient has bleeding, you have to assess where maybe give other medication or refer appropriately to the other physician who can help the patient according to the bleeding you see. Thank you.
Thank you so much. So I think this is really interesting. I've been learning since the start, and I'm really learning a lot. I think it's the same to other attendees. So the last but not the least question I have for you is about baby teeth. Some parents think that baby teeth is not necessary to care about
What
because
is
they will.
happening?
You can't hear me? Hello?
Elisabeth?
Can you hear me now?
You're
Me, I'm
audible.
not getting her.
Yes, we can hear you loud and clear.
Oh, so Professor, can you hear me by now?
Not really.
So probably, can you
Maybe
try?
try again because I'm not getting you. I don't know whether it's me. But if problem, you can cross-check the internet.
But me, I'm able to hear loud. It's just clear.
It's clear. Okay,
Can you
maybe
hear me
it's
by
my
now?
side. Now I can hear you well.
All right, that's good. So I have the last but not least question for you, and it's about baby teeth. Some parents think that it's not necessary to take care of baby teeth because they will eventually fall out. So what do you think, and maybe what's the science behind?
Okay. Can you hear me now?
Sure, loud
So
and clear.
maybe I can start by saying that, primary teeth are, okay, primary teeth are key to children overall health and even the normal development. So I can say that parents should take much care of primary teeth because they are essential for many functions, including chewing and nutrition. So when the primary teeth are healthy, the child can, eat healthier, chewing well, having a good digestion and balanced diet, which is essential and necessary for her normal growth and development. So primary teeth also help for normal speech and development. So when a child has healthy primary teeth, can easily, speak and pronounce, yet some, sounds area in development compared to the child maybe who has the primary teeth defect. So it's important for the parent to understand that and really to avoid neglecting the primary teeth, thinking that once they will shed off, then they don't have to take care of them. So primary teeth also help to, for the normal development of the face, the appearance, they support for normal facial structure. So when the teeth are normal, that helps the appearance of the child, the development of the jaw, the facial expression. So all those are important. That is why it's important to let parents know that tooth should be in the mouth the whole time they are supposed. Primary teeth should be in the mouth during the whole time they are supposed to be in the mouth, not really thinking that once they will shed, we don't have to take care of them. So maybe to give an example of some defect associated with the negligation of, the primary teeth, we can first talk about the development of early childhood care, what is known by early childhood caries, ECC. Those are the caries in children, young children, and really they are harmful to the growth because they are associated with much pain, difficulty in eating, difficulty in speaking, they affect the quality of life and it's difficult for the child really to eat healthier. So you understand that early childhood caries is a big problem when the primary teeth are neglected. So parents should be informed about that and really be advised to take care of the primary teeth. So primary teeth also, when they are neglected, they are shed before time. And once they are shed before time, that leads to the malalignment or malocclusion later in the permanent dentition because the primary teeth help to maintain space for permanent dentition. So once they shed before time, it's really a big problem. So we can't forget about, those speech communication problems we have seen. So if the child, has issue of losing teeth area, you understand that speaking will be difficult. And also, I can't forget about psychological issue associated with, the problem with primary teeth, So I can give an example of maybe a child I recently looked at in the clinic where all teeth were affected by caries. So the child has really extensive early childhood caries, and it was difficult to cope because you can see that the child really is psychologically affected because the child was brought to the dentist many times. He was exposed to the anesthesia. He know the pain about extracting, trying to feed. The infection are there. You can see that there is really psychological issue associated with the this problem of primary teeth. So, and the other issue I have seen with that case, it was socioeconomic effect to the family, to the parents, because the child was not able to cope. We were to transfer her to the clinic where they had to do those things under anesthesia. And then later on, the parent had to call me, telling me that, you know, the payment was around 1 million to be able to do all those things. So I am not able to pay this. Is there any other advice to give me? Because I can't really make it to help this or to pay this bill. So yes, we had to prescribe some toothpaste to help. But you understand that that kid is living really miserably. He can't eat comfortably. The growth can be affected, without forgetting even the school performance, which is emphasized even in the literature, where the kids are affected with those early childhood caries and other tooth defects. They perform low in the school because sometimes they have to miss the classes, the concentration is low, they can't eat because of the discomfort of the teeth. So you understand that, when you negligate the primary teeth, the kid will really suffer, and the parent has to understand you have really to give them information about the importance of primary teeth and the consequences associated by neglecting them. So maybe to conclude, I can say that the good thing, some of the I've seen are modifiable, and most of the, oral diseases are preventable if really we can apply the appropriate intervention. We can really be able to help prevent those diseases more than, because also those dental diseases, sometimes they are expensive. Coming back to our context where even the insurance cannot pay everything. So it's better to prevent than cure, as it's said. Thank you.
A round of applause to Associate Professor Julien Mrenene. Thank you so much for being with us in this session. Thank you. Thank you. Well, we are coming.
Thank you.
Yeah, thank you so much. Thank you. I can welcome Dr. Benedict Amalim on the floor, and I will be asking the first question. Dr. Ben, can you hear me? Hello. I was saying I want to welcome Dr. Ben on the floor. I'm not sure.
Can you see Dr. Ben is muted? Dr. Ben, if you are talking, maybe you can unmute. I can see you are muted.
Yeah, hello.
Maybe unmute. Okay.
Yeah, thank you. I just have two questions for Dr. Ben. The first is like many people say in some communities they believe that wisdom teeth need to be removed. Is it really necessary, or if it is really necessary, what are the signs that shows that wisdom tooth has to be removed?
Okay. Good evening. Sorry, I had a long day, so you pardon me with my voice. Um, Thank you for inviting me to be part of this workshop. I think to explain the question. Oh yeah, Professor Julie, it's nice having you around, and all protocol duly observed. Let me go straight to the meat of the question. Um, let me just do a little bit of okay, yeah. I want to do a little bit of a slide sharing if it's gonna work. I want to do a little bit of slide sharing to answer your question. Okay. Um, what what do we say is wisdom tooth? Okay. So can you see my screen? Can you see
Yes,
my
we can see a
screen?
screen. Sure, we can.
Yes.
Okay, so I just did a very summarized, just to address that question, a very summarized presentation. So I will just use that to answer your question, right? Um, what is wisdom tooth? Why? What is the myth surrounding wisdom tooth? Um, I will start like this, right? The wisdom tooth is the last molar tooth to erupt. Usually, it has a range of eruption depending on locality. Um, Usually, the wisdom tooth is called wisdom
Are
tooth
you
because
getting Dr. Ben? Me, I can't get him. So maybe let him know that if
We
hello,
can get
can
him loud and clear.
good. So wisdom
can
tooth
you hear
are
him?
actually called wisdom tooth because it has some origin. It came from um, some Greek philosopher, which attribute the eruption to when you become mature, right? Because usually it's the last to come out, and it's said to come out at the end of the teenage rebellious years, right? The tumultuous, the troublesome teenage years for the parents when you're expected to be mature, an adult. So it has a wide range. From 17 is said to start coming out. In some people, it can even come out much earlier, right? Then it's said at the age of 21, you're supposed to have erupted your wisdom tooth. So because it's usually the last tooth to erupt, now is said to be the runt of the litter. That means everybody has come out ahead of him. Now, whatever is left over is what this tooth deals with. And usually there's a space problem. So, because of the space problem, it erupts abnormally. So, that's about the wisdom tooth, right? So, the wisdom tooth is actually said to be an impacted tooth most of the time. Impaction means a tooth that erupts abnormally because of lack of space or for one reason or the other. So, certainly, the question you said, should all wisdom tooth be removed? The answer is certainly no. There are guidelines when wisdom tooth should be removed, and those guidelines are what we call indications for removal. Otherwise, they should be left alone, if for nothing else but for the possible complication that may arise with removal. As we know, removal of a wisdom tooth is a little bit more complex than the standard removal of any other tooth. So removing a wisdom tooth, if you are not skillful, even if you are very skillful, it depends on how the tooth is located. There may be some little complication here and there. So if there's any possibility to let sleeping dog lie, you let them lie and move on. So what are these guidelines to aid us when we want to remove a wisdom tooth? Before we talk about the guideline, what do we do if we want to keep them? So if a wisdom tooth is well aligned, that means it's erupting normally and it's not coming out abnormally, it's coming out vertically, upright, then we should leave it alone and watch the tooth. There's no need to removing a wisdom tooth when it's well aligned. Also, when it is fully erupted, a wisdom tooth is fully erupted, and then you said, "Oh, let us remove it." Usually, we tend to leave it alone, except there are instructions otherwise, which we will look at in the next slide. Also, when there are no symptoms associated, right, it's not showing sign of being infected. The wisdom tooth is not giving you pain, there's no swelling, there's no discharge coming out from around the gum around the tooth. So at that point, we say leave it alone. Then when the tooth is just newly formed, the individual is just 10 years old, and then he said, I want to remove my tooth. Why would you want to remove when the tooth is fully formed? You don't even know whether it will come out properly or not. So there's a new teaching that says you do the wait and see approach. You observe the patient, you put the patient on your list for observation and watch how it's coming out. If it's coming out normally, then you should not go and do any surgical procedure. Okay, so we talk about guidelines for removal, right? As I said earlier on, wisdom tooth should not all be removed. It's a myth that should be discarded. So these guidelines are actually called indications, right? Indications, or what happens if a wisdom tooth start causing you problems or complications. So one of them is called pericoronitis. Pericoronitis just means inflammation or infection of the gum or gingiva around the erupting tooth, right? So that last tooth, if there's any inflammation around it, which you would know by pain or swelling, right? That we call pericoronitis. Then you should go for a dental checkup and they'll decide what to do. They decide when that tooth should be removed. Or when you have tooth decay, which we call dental caries. In dental caries, the wisdom tooth may, because for a reason or the other, because of accessibility, is the last tooth, so you're not able to access it properly. So it becomes carious, or the tooth in front of it, the second molar, becomes carious. In that situation, you might opt for extraction of the wisdom tooth. Another one is what? Periodontal disease. When the surrounding attachment tissue around that tooth is inflamed, is infected because of you're not able to brush it properly, or food gets stuck along that tooth, for one reason or the other, the periodontal tissue becomes inflamed. That may be an indication for removal. Okay, so because we are talking about myth, there's what they call dream versus reality. So you can see from this picture, the man looks so big in the dream world. Reality, well, your guess is as good as mine. So we are dealing with reality here. So the reality of indications are they also when the root is resolved. That means if the tooth is causing an effect on adjacent tooth or teeth, right, by causing them to resolve, to decay, then there's an indication for removal. Then if you it's going to cause an obstruction, if you want to put a prosthesis or a denture there, it's going to you look at it, the prosthodontics thinks it's going to obstruct his prosthesis. Then you may need to remove them. Then the last one is on orthodontic recommendation. That means the orthodontics recommended that this tooth needs to be removed because it will affect my alignment plan for the teeth. For those who have crowded dentition, the orthodontics are those who fix crowded dentition. So if an orthodontics assess and said this tooth will affect my plan, then the orthodontics now recommend that the surgeon takes out the last molar and then he knows what to do. So how do we identify a tooth that are impacted? There are different type of impaction, right? The most common one we're talking about is called the wisdom tooth, which has to do with the last 10 molar. But there are others, others that can be impacted, like the picture we show you, upper picture we show you the canine impaction in the maxilla, the upper jaw, and then you see the lower jaw, which is the mandible, you will see a wisdom tooth impaction. The impaction means the wisdom tooth is going to come out, but there will not be enough space. So it's going to cause problem. And that scenario, the orthodontist will recommend that such a tooth should be extracted. Now, because of time, I have to be fast. Now, if you do extraction, there are possible complications that may arise, right? So this is why some of the complications they're definitely going to be pain, which you may use antibiotic, but it's a surgical procedure which we call surgical disimpaction. So if you're going to remove your wisdom tooth and you do a surgical disimpaction, you are going to have pain. There may be infection, there may be bleeding, and a lot of other complications which are listed here. So I'm not saying that this complication must happen. Neither am I saying that all of them must happen. But complications means that it's possible it may happen, right? So if there is any chance for the wisdom tooth to not to remain in where it is, of course it should remain. Especially when if it is when well aligned and fully erupted, it contributes to the masticatory force, the grinding force of the molar teeth. That's for your question. Okay. You asked another question. Elizabeth, did you ask another question?
No,
Oh,
thank you. It's all about the wisdom teeth. But I have another question, of course, just one.
okay.
Some people say that dental problems are not serious when there is no pain. You only need to see a dentist when you feel the pain. Is it actually recommended?
Okay. Um, Actually, you actually let me try to define that. You don't see the dentist because of pain. You see the dentist as a routine visit. In the Western world, the dental visit is something that is ironclad in the calendar. You see them say, I'm going for my dental appointment. I dare not miss my dental appointment. It doesn't mean that there's something wrong with them, but just for the dentist to review them and see if there's anything that can be averted. Now, if you have, there are a lot of there are a lot of problems you may have in your oral cavity in your mouth that may start without even showing you pain. One of them is cancer, right? When we talk about oral cancer, it usually starts painless. So if that's why we have a challenge in Western country in the developing countries, people don't present on time. They wait for pain before they present, and when there is pain, usually it is advanced. The tooth is a tough soldier. It only cries out when it has undergone too much torture. So when the tooth starts telling you there is pain, it means it has undergone serious abuse. So it's not doesn't make sense for you to wait for pain. Pain is not a good sign. It's recommended that everyone should see the dentist at least twice a year for routine checkup. For them to look at you and say, okay, there is a problem here, we can address it on time. Why? The implication is that it will save you cost, it will save you time, it will avoid you going through some discomforting dental procedures, right? It will even save you the loss of your teeth. And this, let's not forget the psychosocial effect of people going around with missing teeth or decayed teeth or problem that comes with a painful teeth that is not addressed. We have had issues of people coming to see the dentist because of pain, and we discovered that the pain is not even what is your problem. It has gone beyond the pain. You now have an abscess. You needed to be admitted. So imagine if that person is the breadwinner in the family, now he has to deal with another problem altogether. So we don't advocate people to go when you have pain. It is advocated that you should go and see the dentist whenever your time for routine dental checkup is. That way, you avoid problems that may come, and if there are problems that are early detected, and then they are addressed as soon as possible. Right. Um, there was another question you asked me. Should I go on with the rest of the question? Please, if you need clarification, you can raise your question. I will give you clarification.
I think
Um,
because we are
yeah.
rushing of time. It's already
No,
one
don't
hour,
worry,
and I
don't worry,
know,
don't worry.
yeah.
I can quickly take some little minutes of my time. Yeah.
All right. Thank you. Maybe I can take like one more question, and we address the questions from the audience. I can see that they have a lot of questions.
Okay. Right. So
It's
one
very
more question.
interesting. Yeah, one more question. So some people, when maybe they have accidents, they say that they think that maybe the damage will heal on its own. The teeth will heal on their own. Is it recommended? Maybe if you fall, if your teeth get some problems, should you spend your time home waiting for them to recover on their own?
Actually, that should not, you should not do that. And first of all, if you have an accident, the first thing for you to do is to go to the hospital for a checkup. For various reasons. First reason is your tooth may not actually be your only problem, the only problem you have. We have people who came to the hospital complaining of their tooth, and then they will discover that they had a blunt chest injury, and then they never noticed, right? Or they had other injuries that they never noticed. And so it's good for if you have an accident, you go to the hospital. But let's address the situation if you have a dental trauma and then you decide to leave it alone. What can happen? Now, a lot of things can happen, and I will try for us to just get this picture. If you have a dental issue, I think I noticed something. Um, let me see if I can pull it out from one of my. Uh, yeah. So will they heal by themselves? They don't heal by themselves, right? They usually become infected. A tooth is a living structure. So when it's traumatized, it usually becomes infected. Now, when it becomes infected, um, it can, if it is a deciduous tooth or a primary tooth, what happens to it? It will end up affecting the permanent tooth that is still within the bone. And there's something we call Turner's tooth. So when the permanent teeth erupt, it becomes dark, discolored, malformed. Why? Because the primary tooth was traumatized and it was not addressed. So because it wasn't addressed, it affects the permanent tooth. Now, this is the permanent tooth. It's not going to come out. It's not going to, you have to live with it all through your life. Now you have to look for a way to manage the abnormality that you would have avoided. Now, if what other complication can arise if you leave a tooth damaged by trauma? It can cause an abscess. Now, and the abscess can be severe to the point that you need to go for surgical operation, you need to be admitted, you need to be given IV drugs, you spend time in the hospital, right? And if you are not addressed properly, it may even cost your life, right? So for some of them, it can progress to what we call radicular cyst. It can form a cyst. There is swelling of the jaw, which we require you going to theater to remove the cyst, and then you know what that will entail, the cause and everything. Now, for some of them that doesn't even form this cyst and the rest, because when there's trauma to the teeth, it will damages the blood supply. So what happens with time, the tooth loses the color, the hue around it. So it becomes dark, discolored. You've noticed people going around with discolored teeth. Yes, some of them because there was trauma that happened some years ago and they just left it alone. So it becomes discolored. So they go around the street and it can affect their self-esteem, the way they talk to people. They can't smile properly because people will ask them, "Hey, your teeth is looking discolored. Is there anything wrong with it? Or it's normal. It's not normal. Go and do something about it." So aesthetics becomes a problem, right? For some, if you leave your teeth after being traumatized, they may become displaced and deranged. So you need expert assessment when your teeth is damaged by trauma, right? It's not, and you can't leave them, they don't heal by themselves. And if they heal by themselves, that means the problem that they have initiated will now worsen with time. So by the time you go to see the doctor, he said, "Why didn't you come early enough? We might have done something that we might have prevented this problem we have right now." So to avoid advanced issues, if you a tooth is traumatized, we advise you go to see the doctor, and then the doctor will assess such a tooth and this give you the best option for early remedy and treatment of such a tooth. I think that should suffice for now.
Can't hear you well.
Oh, you can't hear me.
And now we can.
You can hear me now.
Yes, we
Sorry.
can, we can.
Yeah, I said that I was talking about the implication of leaving a tooth non-attended to, and I said there are aesthetic concern because the tooth might become discolored. It might lead to an abscess formation. It might later on, you might actually lose that tooth because it might become mobile, and then you need to um, remove the tooth by the dentist, right? And then it can even form an abscess. It can form a cyst. A lot of complication can arise when a tooth is traumatized. So that a tooth is traumatized doesn't mean that it is you leave it alone and it looks okay. It may look okay for the first short time, but after a while, the effect of being deprived of blood supply due to the trauma will now set in, and then it become discolored and become infected and start bringing out pus and bringing out swelling. We have a lot of people like that in the hospital now. I actually have two cases I'm going to do on Monday, which have radicular cysts large enough to fill the palate because they did not come on time. So they waited like 3 years, and the cysts keep growing bigger and bigger and bigger. And imagine the destruction the cyst has caused to the palate. So if they have come early when that trauma occurred, we would have done other more milder procedure that will preserve that tooth and avoid that cyst formation. You can hear me,
Yeah, thank you
right?
so much. Thank you so much. I really learn a lot. I think you guys are learning, especially those who are still students, either in dentistry or some just doing other faculties, or even not students, other professions. Thank you so much. So
Yeah,
maybe we
I'm seeing
can
some
start.
questions.
Eh?
Yeah, some questions are. I'm seeing some questions.
Yeah, you've seen too. Maybe if you, I think you can be able to read through the questions, especially the ones addressed to you. I think you can start from you.
Okay. Well, the questions I'm seeing are more for Professor Julian. So maybe if you can see any question
Yeah.
for me, mine. I'm searching for a
Okay.
question for me.
Maybe you can help us discuss on this for Olivier. He was asking on Ibduinyo. It's like baby teeth when kids with 1 month or 2 weeks develop some teeth. What advice can you give? Should they be removed, or is it normal? Is it a woo? What can you tell us?
Oh no, 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 no! When a child has a baby teeth, please don't remove it, because you will cause a lot of challenge. We have a lot of orthodontic malocclusion. Malocclusion means the teeth are not properly aligned in this country, and it can be traced to early removal, especially of the canine. It's a traditional practice that is being done here, but the after effect is that years down the line, the dentition are not properly aligned. So most people go about carrying braces. So you don't remove baby tooth because of a custom or tradition. You have to allow the baby. If you feel the tooth should be removed, go and get an expert advice. Go and see the dentist and tell them this is what I intend to do. What is your advice? And they'll give you a proper advice. Because the challenge is in the eruption of the tooth. There's each tooth uses the other one as a guide. So when they want to erupt, the baby teeth remains there to guide the permanent teeth, the adult teeth. So when there is no guide for them, they erupt haphazardly, they erupt disorderly. And then when they erupt disorderly, you have to come to me the orthodontics, and then you pay big money for realignment, which you could have avoided. So early removal of baby teeth is not advocated, please. And if you see people who are doing that, you have to counsel them that they should stop doing that, because later on they were going to spend a lot and subject the child to long period of orthodontic realignment. Does that answer your question? Okay, I think I'm seeing a question from you now. Stephen asks, are there common complications you wish um, in which dental digital tools could help predict or prevent. Okay, complications. The X-rays we make a proper trained dental practitioner to anticipate complication. So when you take your digital tool, take a digital X-ray, it can show you, okay, this tooth, this wisdom tooth, for instance, is close to a nerve, right? Close to a nerve or a vessel. So you now plan how to remove it so that you will not traumatize the nerve or the vessel. So they can help to predict complication that might arise. If those tools were not there, you will not know. So it is advocated. That's I said that's a good question. It's advocated if you are going to do an extraction for a wisdom tooth, don't do it blindly. No matter how good you think you are, please always go for an X-ray so that you can know exactly the position and the surrounding structures around that tooth. So that if there's any complication that you might have, or you may decide, okay, this might need a specialist treatment, may just need, because there are some cases where you may need to go and see the oral maxillofacial surgeon. It's not just any dentist, otherwise you will have serious complication afterwards. So there are some cases that the um, general practitioner can do, but there are other cases that they have to refer to the specialist to take care of. Right. Okay, somebody is asking another question here. Let me see. They say his tooth had been there for 3 years without being fully erupted. Is there any possibility to fully erupt? Right. Someone is asking eruption if it has been there for 3 years. Now, the sequence of eruption, if your tooth start erupting, let me give an instance at the age of 17. Now, the root formation for every erupted tooth is said to be completed maximum 2.5 years. So some say from 2 years to 2.5 years after eruption, full eruption in the mouth, the root is fully formed. And so that means if there's any movement again, because movement of tooth in eruption is guided by the root formation. So if there's any movement again, there will be minimal or no movement anymore. So that means the tooth is fully formed at that period. So where it is where it will remain. It's not going to move any change any direction anymore. So if it is not erupting properly when the root is fully formed, that's how it will remain. So if it is impacted at that period, it's already impacted. Now, there are some that even the root, even while the root is still not fully formed, you already know it's going to be impacted because it's the angle of eruption is totally wrong. Instead of facing upwards, it's facing downwards. So even if the root keep on forming till it's fully formed, you already know that that one is not going to come out normally. So we don't wait for such cases. But there are some cases where you can actually wait and observe and decide. But after 3 years, there's nothing to wait for anymore. You go for a specialist to assess and then decide where that tooth is particularly, and then it has to be removed surgically. Yeah. Any more question? Okay. Someone is asking, um, how
I feel
many how many exactly quantity of fluoride in? Okay. Well, question for fluoride. Is that for me? Is the fluoride question
so.
for
There are
me?
also questions addressed to me. I was not able to scroll it through this chat, but now I think I can.
Okay. I
There
think
are
the
some questions
fluoride
addressed
question
to me.
is for Professor Julia to answer.
I don't know
All
why I can
right.
scroll. Okay. So
One more
Elizabeth, why
question
can't
for
I
you,
scroll?
Dr. Ben.
Okay, I'm
You can
listening.
scroll in the chats.
Good,
The
good. Now
last,
I
yeah,
can.
this one. For Queen Tridera. Question to
Okay,
Dr. Ben. Can
let me just
Ludwig's
answer
angina
the.
be a complication?
Okay, let me just answer and leave the floor for Professor Julian to finish her question. Okay, the last question from Queen Chidera. She
All
said,
right.
can lordus angina be a complication of untreated dental caries, even in the absence of immunosuppression? Oh, obviously, yeah, it can be. Um, Immunosuppression can be transient. Let me give an example because if you have
Can't hear you well.
okay, let me come close to my screen. Can you hear me better now? Can you hear me better?
Yeah, sure. Now we can.
Okay. Now someone was asking about Lodix angina. Now that condition is a severe life-threatening condition that occurs from dental problem. Now, can you have it when you're not immunocompromised? Yes, because there's what we call transient immunosuppression. That means if you have like malaria, at that period you're immunosuppressed because your immunity is being assaulted, right? So sometimes the immunosuppression might not be because you have a disease like HIV or diabetes. It may be malnutrition. You're not eating properly or you're not resting properly. So stress can reduce your immunity for a period. If it becomes sustained at that period and then you have a dental problem, it can lead to Lodix angina. So yes, your answer, I can say yeah, yes to your question. So you may have Lodix angina and you're not necessarily immunocompromised. But most people that come with Lodix angina usually have one immunosuppression or the other. It may not be a disease state, but it may actually be due to like common thing like malnutrition. People don't eat properly, so they already they don't have diabetes or HIV, whatever, but they're not eating properly. So those ones, yes, they can have Lodix angina, right? So it's not just for immunocompromised. It's rare to find it in immunocompetent. But like I said, when you go through a phase when your immunity is suppressed for a while, that period, it can, if you have a tooth abscess that is not well taken care of, it can progress to Lodix angina. Does that answer your question, Queen?
Quintry, there maybe you can raise a thumb up if your question was answered.
Okay. I think I think
Right.
I might. Is there another question? I'm done with the question session.
No, you're done. Maybe let's welcome Professor Julien to answer the questions
Okay, so
addressed to her
let me leave
as
it-
well as so we can.
let me leave the stage for Professor Julian to take over.
Yeah, sure. Thank you
Okay,
so
I
much.
can see that the first question addressed to me is that are there possible signs that someone, not just oral health professional, might notice when they are brushing harder? Yes, of course, because you have seen that brushing harder is associated with tooth recession. You can have enamel abrasion and even you can have root cavities and even the signs of bleeding. So someone who is brushing harder, so with time, himself or herself can notice the recession. He can notice that even we have patient complaining, I can see that my gum is, going away from my tooth. I don't know what's happening. Yes, they notice. Yes, they don't understand what maybe is causing that, but they can notice that the gum is really not at the same level it's used to be. Another sign is the bleeding, because using also too much force can cause the gum to bleed without even being maybe the part of the plaques you have seen. So you can traumatize the gum and see it bleed. While brushing, you see the gum is bleeding because of that too much force you use on the tooth surfaces. So another thing you can see the yellowish color when you brush. There is tooth abrasion, and you can see that the dentin is exposed. Where once the enamel is worn away and the dentin is exposed, you can really notice the yellowish color of the enamel through the when the root is exposed. You can identify that. So of course, you can see that the root is exposed. You can see that why my tooth, I can see the roots, the part of the roots, So those are some of the, the sign the patient can notice himself. And some they come, complaining of that. Those are signs. And among the symptoms, we can talk about the sensitivity, what they feel also about that condition. But those are some of the signs a patient or a person can notice while brushing harder. So any other question to me? Thanks for this. What called ibyinyo? So someone is asking about what is called ibyinyo. I don't know English term. So English term is infant oral mutilation. If you go and read about infant oral mutilation, you will understand better, and you will see even more work done. So although in Rwanda, so now we have a project, ongoing project where we want to work on it to see how is the state of oral health mutilation in Rwanda. There are other, few studies done. You can maybe look at them. But infant oral mutilation, or that term in Rwanda is ibyinyo, and the term are different depending on the country. Is a traditional practice where the primary canine tooth bud is removed by traditional healers using non-sterile traditional instruments, and they think that tooth bud is a worm causing common oral illness to the kids, to the children, especially when the children have the fever, they are diarrhea, or they are vomiting, those practices are done. And maybe in your community we were able to notice that, I don't know. But we are trying to, to develop a proposal, to do a research to see what is the state of that in Rwanda. So that practice is done in most of African and East African countries, including Tanzania, Uganda, Ethiopia, Rwanda. It's done, although little research was done on it, but we know that practice is done in Rwanda. As we have also a term known as ibyinyo. So that is short what is about the ibyinyo or infant oral mutilation. You can read more about that. There is so much information about it in the literature. So any other question addressed me? Okay. Is someone working on dental digital tools? How do you know that? So what are the biggest gap in oral health education that digital tool could help close, especially in rural resources, rural communities? You were to prioritize, if you were to prioritize 3 preventive messages that every digital, so there's so much gaps, that, digital tool can help. So if I can maybe give an example of what I think, because when it comes to suggest, you have to have evidence-based, you have to do research and identify that this gap is here, this tool can help this. But according to my experience and to the context of Rwanda, I think that if we could maybe come up with, a digital solution to target, the community health workers, because, common oral diseases which can be easily preventable are at high prevalence in Rwanda, and that was also highlighted by the Ministry of Health, those dental caries, those periodontal diseases. And those are the diseases which can easily be preventable through, raising awareness, engaging the community, to take a good oral hygiene practice. If we could come up with a digital tool or solution to target, the community health workers who are daily working with the people in the rural areas, maybe to be able to empower them to contribute to the promotion of oral health. Maybe using an education, messages or education materials at level of our community, because that the literature level is low really among our communities, and when we have to educate them, we have to go with appropriate messages, simple messages they can understand. So if there could be a digital solution to target maybe community health workers, empower them to support, raising awareness in the community, especially in the rural area, on the prevention of common oral diseases, including dental caries, including periodontal diseases, that could be our way some. So when it comes to 3 preventive messages, every digital solution tool could teach. So, the first one is, to emphasize on the good practice, good oral hygiene. The second one is the importance of, visiting regular dental visit. You understand? That is something which is missing in our community, and also another one regarding the myth or the dental belief or the misconceptions. If we can, target those 3 messages, maybe develop educational material regarding those 3 areas, that could be some. But it's up to us also to do research, because not much was done really in Rwanda to show the gap and whatever. So, but I think with time, we have so much information about the baseline, data on the gaps regarding oral health in Rwanda. So, but that is what I think in my experience. So, any other? I think I'm done. Elisabeth, let me know whether there is another.
One more question left. Yeah, one. Someone asked that any interval between meal and brushing. Any recommended interval of time between meal and brushing?
So normally we are recommended to brush after taking the meal. I'm not sure about the exact time, but maybe to say that if you, after taking immediately, let's say the tea, which is 2 cups, I think you can't immediately take the tea and immediately maybe go to brush. Maybe you can take some time to, to avoid, to give it a time maybe for the hotness to, to be away from the mouth before putting maybe the coldness, because, that also can affect or even cause some sensitivities. But also you can read about that interval. I didn't have the exact, intervals, but it's good to brush after eating. Maybe you can read and inform me later about the exact interval. Someone asked, I know he has half a answer. You can ask the chat GTP and see whether it gives you the answer. I don't have that really exact time. Good. Any other question to me? I think I'm done.
I think you've answered every question that I addressed to you. You've really answered them. So thank you very much for today. Thank you so much. And I want to thank everyone who participated in this Dental-Medicine Chronicles November series. So thank you very much, especially to those who asked questions. I'm sorry we had a limited time. We only had 1 hour. Your questions were not all answered, but I promise you that in the very next DMC series, we will address all your questions. So remember to write them in the attendance list. And everyone who attended, please make sure you fill the attendance list. And about the slides, we will find a way to let them be on your email. Send your email so that Dr. Ben can share with you your slides. And so I think we are closing. Thank you very much for today, especially uh, someone is
Thank you so much for having us today. Bye.
Professor. Someone is claiming that he sent 3 questions. So thank you. I think you are free to leave.
Thank you.